I think you're seeing this in a lot of countries. I think in the UK it's particularly pronounced. But if you look at the United States, if you look at Italy, Spain, you can make these sort of criticisms for most countries. But I think the fact that the Prime Minister himself and some of his senior staff has taken ill has just underscored that there are areas that needed to be improved in the UK's response, especially at the beginning when they were very self-consciously taking a more mitigation-focused strategy rather than the suppression-focused strategy that a lot of other countries were taking.
We've talked a bit about social distancing, and Steve was mentioning it there from Downing Street. But again, we have this story this morning of people playing football in Cardiff together and other situations, parties over the weekend. Do you think the UK government actually needs to tighten the punishments against those who are unwilling to follow the advice?
From my understanding, the modeling that the UK government is using assumes that there's a very high but not universal level of compliance. There's always going to be somebody who's going to be flouting the law, breaking the law, and there is some enforcement powers that the police have been given. The Public Health England is trying to look and see if the curve is slowing, and if it doesn't look like it will be in the next week or 2 weeks, then they probably will put in more stringent enforcement powers.
Matthew, a lot of absolutely legitimate criticisms can be labelled at both the UK government and indeed other governments for their preparedness or lack of as well. But what are they actually getting really right, in your opinion, at the moment? A lot of things are happening very quickly. These new hospitals are being built or readied if need be. A lot more ICU beds are prepared. A lot more medical staff are getting to the front line as well. But in your opinion, what do you think they're actually getting right at the moment?
I think one of the big advantages that the UK has over other countries is that the NHS is a centralized system, and it can be deployed in almost a military fashion, whereas other countries with more decentralized healthcare systems will take a little bit longer to arrange what they're doing. The flip side of that is if there's something like testing, where it's controlled in too much of a centralized fashion, the UK can get behind the curve. But in general, in terms of deployment of resources, the UK has a lot of advantages there.
And we've talked primarily about, obviously, the medical response. What about the economic response as well? I had a slight disagreement with the Finance Minister of Belgium on Friday when we were talking about what governments should do for the short term and the medium and long term, and the legacy long after this pandemic has hopefully gone that we are going to be left with as a country, the debt profile as well. Do you think actually we need to be very, very careful about some of these measures we're putting in place now?
I think right now the key issue is to try and do something that's basically never been done before in the world, which is put an entire economy, put most economies on life support, into some sort of deep freeze that they can come out of in 3, probably more like 6 months. And that's going to require a lot of spending. That's going to require a lot of borrowing. And if you look at the way that the Bank of England has been coordinating with the Treasury in a way that's been unprecedented in peacetime, you're seeing that the central bank is basically moving from looking at interest rate levels to backstopping government debt for what could be a very long period of time.
Hi, I'm Joanna Bersecci, and thank you for watching. You can check out more of our videos by clicking on the boxes on the screen. And don't forget to subscribe to our channel for more from CNBC International. Thank you for watching.